The pediatric orthopedics, first mostly they are used for congenital dislocation of the hip. This was the most popular processes earlier. It is called pelvic harness. We don't use it much now, but in the exam you may have a pelvic harness. So this pelvic harness is used to keep the hips in flexion and abduction. At the same time, allow the baby to be free. So it has a thigh band, and then you have two cuffs which are put to the ankle, and then you adjust in such a way that the hips are in abduction and external rotation, thereby you are containing the head into the acetabulum. So this is the classical pelvic harness, and this is how it is being applied to the child. And if you look at the pelvic harness, so it will have an adjustable band enclosing the lower chest. So this is the one, you put it around the lower chest. Then you'll have a pair of shoulder straps which go around the shoulder and these things, and then you have stirrups to embrace the legs, that is on either side you have the stirrups. Then you have suspensory bands are there. So once you put the child in this harness or the brace, the hips automatically go into flexion and abduction, thereby trying to retain the head of the femur in the acetabulum. So over a period of time, by maintaining the harness, as the child starts growing, the head starts developing and the acetabulum starts developing, thereby the chances of dislocation are reduced. It's a very simple process, very useful process, not very cumbersome. The child can do all movements except that he cannot adduct the hips and cannot do an extension of the hip. The basic principle of this process is allowing all the movements except hip adduction and hip extension, whereby the head gets dislocated. Similarly, a more simpler form of this, which was much popular much earlier, of course we are not using now, but still some places you may have this splint. As in history they might ask you, it's called Rosen Splint. It's a H-shaped splints. Again, you'll have two upper limb straps over the shoulder. Then these shoulders will get you have a chest band. Unlike the other thing, this chest band is small. Again, you have the thigh supports or the lower limb splints, where the hips are again are in 90 degrees of flexion and 45 degrees abduction. Again, the principle remains the same. The hips have to be in abduction and flexion, thereby you prevent the dislocation of the hip. Rosen splint is almost similar to the pelvic harness, but pelvic harness is practically more adjustable because you can adjust everything. Rosen splint is more custom made specific to the child, and you need to keep this changing and the child starts growing. But both are used for congenital dislocation of the hip. The principle, if they ask you what is the principle, this harnesses or the splints